Reporting there. Well, joining me now is Professor Adam Fox, who is an expert in food allergies at the Evelina Hospital. Thank you for being with us. These deaths are so heartbreaking when they happen. But how many deaths happen a year from food allergies?
This is every food allergy family's worst nightmare. We think it's probably around 10 deaths in the UK a year. And bear in mind that 5% of all of UK children are affected by food allergies. So thankfully it's a tiny amount compared, but everyone's a tragedy. And we really need inquests like we're having now to really understand what went wrong so we can do our best to make sure it doesn't happen again.
So many of us have children with severe food allergies. What's your tips? What's your main advice to them?
I think the key learning from previous inquests is the importance of making sure that if you're at risk of a severe reaction, that you carry adrenaline, your EpiPens or Jext pens at all time. You know how to use them, you make sure that they're in date, and you're not frightened to use it. If there's any sign of a bad reaction, it's always better to use it early, even if you didn't really need it, than have a delay and not use it.
And in recent years, we have seen a rise in the numbers of children and teenagers being hospitalised for severe food allergies. Why is that?
I don't think we really understand, but it's really easy to fall into the trap of thinking it must mean that there's a lot more children with food allergies around. And actually the evidence doesn't suggest that there's more food allergic children, just that we're better at recognising it, that there seems to be more of a chance of bad reactions. But thankfully there doesn't seem to be any evidence that there's more deaths from food allergy.
And tell us more about the perception that more and more people are suffering from food allergies. Is that true?
Well, I think there's certainly a lot more allergy than there was 20 or 30 years ago. There's more food allergy around than 20 years ago. But I think the idea that we're on this sort of upward curve that's unrelenting probably isn't the case. I think it's probably just about plateaued, but we're still seeing this is a huge public health issue and it needs a lot more resource to address it properly.
If there are more people suffering from food allergies, why is that?
I don't think we've got a good understanding. We know that you're more likely to get food allergies if you've got eczema, and you're more likely to get food allergies if there's a delay introducing allergenic foods like peanuts and other nuts, for example, into the infant weaning diet. So we always encourage people to think carefully if there is a eczema in the child, think about early introduction of those allergenic foods, peanuts, tree nuts, sesame, egg, into the weaning diet, because that's the best way of reducing the risk of food allergy developing.
And just to repeat, what is your main advice for anybody, any parent out there who is worried about their child and their severe food allergies?
I think a really good idea would be to visit the websites of Allergy UK or Anaphylaxis UK. They've got really good resources and there's a guide on there about things you can do to reduce the likelihood of having a severe allergic reaction. The key one being about carrying adrenaline, but also making sure that if your child's also got asthma, we know that increases the likelihood of bad reactions, making sure that it's identified and that it's aggressively treated so that you can reduce the risk of a bad reaction happening.
Tell us more about adrenaline pens, because this is crucial to people with severe food allergies.
Yeah, so we're talking about what most people would refer to as EpiPens, but there are other brands such as Jext, and they're pens that carry adrenaline, which means that you've got that medicine available to you straight away if you're having a bad reaction. It works best the earlier that it's given, and it's a very, very safe medicine. So using it early, as soon as there's any suggestion of a bad reaction, so any trouble with breathing, anything affecting your airway, anything affecting your blood circulation, so feeling dizzy, or if you just think this is a bad reaction, then just get on and use it, because in the vast majority of cases, it will make a real difference. And if it hasn't made a difference in 5 minutes, you should be using your second adrenaline pen. And hopefully by then, somebody should have called for help. Help's arrived. They've got a much better chance of making sure that you recover.
And 2 pens, crucial.
Yeah, always carrying 2 pens at any time, because around 20% of people that need the first adrenaline injection will need a second one. Now, usually the paramedics will be there, but they might not be. And of course, there's always a chance of it misfiring or not working, although they are very reliable devices. But I think sometimes people haven't been practicing. You can get trainer pens to make sure that you know exactly how to use it. So making sure you've got the right dose, it's in date, you always carry it with you, and use it as soon as you think there's a bad reaction. That's going to give you the best outcomes.
Professor Adam Fox, thank you so much for that. Thank you. Now, drivers from across the